October is Breast Cancer Awareness Month, a time to show support for everyone affected by breast cancer, but it's also a time to educate yourself.
Dr. Wendy McDonald joins us now to share some facts about cancer, breast cancer, and debunk a few myths. Thanks so much for being here.
Thank you for having me.
I mean, I feel like in the pandemic, a lot of people kept putting those mammograms off. We've got to get them in.
The truth, it became a thing that's like you can put to the side because it's not urgent. But the problem is mammograms will catch such early cancer, and catching an early cancer is literally life-saving. Yeah.
But a lot of people are hesitant to get those because for some reason they seem to think that the mammogram itself can cause cancer.
That's the truth. And in the age of misinformation, we have to just debunk that.
All right. Debunk that.
You know,
so not true.
Not true. Not true. Mammograms do have some radiation because it's actually kind of an X-ray, but it's such a low level of radiation that it's not something that would cause cancer. And when we think about like breast cancers that we would feel, they actually are already kind of big when you'd feel it. But a mammogram will catch a breast cancer that you wouldn't even feel. And an early breast cancer that's so small that you can't even feel it, that survival rate is like 99%. We gotta catch those.
Yeah,
we gotta catch those.
I didn't know there's myths around caffeine and mammograms. What is this?
Well, really caffeine and breast cancer or symptoms, because people, sometimes if they drink a lot of caffeine, will have breast tenderness. And tenderness or pain sometimes makes people think that they could have cancer. The good thing is most of the time, pain does not equal cancer, but caffeine can cause pain. And it can make somebody kind of more nervous. So it's one of those things that if you have breast tenderness, you might want to like do an inventory of how much caffeine you're drinking on a daily basis or eating, whether it's chocolate, stuff like that. But it's not correlated with breast cancer.
Okay, that's good.
So I've had friends talk about they have super dense breasts. And so a mammogram is very difficult for them. I mean, so I don't know if they don't not do it, but I mean, they're hesitant about it.
Breast density is actually really common, especially in the African American community, but just in general, breast density can be there. Now, what is breast density? It's basically having more connective tissue than fat in your breast. We think the breasts are fatty, and they typically are, and that means they're really soft. But if you have more connective tissue, they actually are more firm, and the mammogram can't penetrate as easily through that tissue. So sometimes people need a 3D mammogram, which is like a more penetrating mammogram that just looks closer, and sometimes people need a breast ultrasound. I got my mammogram and they told me my breasts are dense. I was like, what breast? I don't know what you're talking about. But I had that same thing where they were more firm and they had to do an ultrasound too.
I had the same thing. I had both of those because, and had a biopsy done just to make sure, and it's something that you can watch a little bit more carefully as you progress. What's another one of the big ones that people seem to get hooked up on?
Some people worry that if they're breastfeeding, they can't have mammograms, and actually you can. You may need to pump or nurse before, but you actually still can have a mammogram if you're breastfeeding, which is important for people, especially as we're like increasing our age of childbearing. If a person is 40 or 41 and they're, just had a baby and they think, well, now I need a whole 6 months or a year before I can get a mammogram, and actually you don't. So that's just one of those things that people should know.
But it's also something to think about. Didn't a study come out saying that if you do breastfeed, it kind of tends to lessen your chances?
It absolutely does. Pregnancy and breastfeeding. Breastfeeding is something that reduces our breast cancer risk. Also decreasing our caffeine. Exercise reduces our breast cancer risk as well. If we increase our exercise, we can reduce our breast cancer risk. And so what else? Yeah, there's a lot of things that can help to reduce our breast cancer risk.
All right. And then finally, self-breast self-exams. So
self-breast exams got a bad rap a few years back because we were concerned that if you checked and found something, there could be like, you could go to get testing and there's nothing wrong, right? So they said, well, they as in the kind of advisory body said, don't do self-breast exams because it'll make you nervous and you'll find something and it's not anything that's of concern. I know. I'd rather find something that was no concern than miss something that is of concern. Finding our own lumps and bumps is actually going to be life-saving. So knowing your own breast self-awareness is the goal. And if you check your own breast, you'll be the first to know if there's something wrong.
Yeah, I mean, it seems so simple, and yet we hear all these sad stories of people we've lost because of it.
Exactly, and especially when people are, kind of potentially at higher risk, especially if there's a family history or something like that. You want to just make sure you're aware of your body, that you're getting your screening. It's kind of the best thing that we can do for ourselves.
Got a little rap for us?
I do.
Okay, bring it.
If you ask the question, should you check your breast, then I'll say yes. It's self-awareness. There's no need to be stressed. Put your worries to rest and do your best. Put your fingers to the test.
All right. Put those fingers to the test.
Yeah.
All right.
I love her social media. That's great. You got to keep an eye on it.
All right. There it is right there. Get all the information from Dr. Every Woman.
Fantastic.